Greene. How are you?
I'm good. How are you?
I'm fine. All right. So, where are you from?
Originally Nassau, Bahamas.
Okay. And what led you to chiropractic?
Um, 2009, I was in a car accident and I went through the x-rays, I went through all the scans, they couldn't find anything wrong.
Mm-hmm.
However, I couldn't walk. I had no feeling in the bottom half of my right leg and some parts of the left leg and my thigh.
Oh,
And
wow.
yeah, so they released me from the hospital. They just gave me like 3 months worth of medication, and it was just bed rest and medication. So maybe about a month and a week in, my mom was like, giving me a massage. At this point, I still couldn't do anything for myself.
Mm-hmm.
And she was going over my spine, and I was like, that's really painful. Like, it was excruciating pain. And she was like, okay, I'm going to a chiropractor, so maybe you should go see a chiropractor. Like, let's see what's going on.
Yeah.
I went to a chiropractor, and I kid you not, like 9 sessions, which was maybe 3 times a week for 2 weeks and some change. I was walking. The feeling in my legs were coming back, and I wasn't having that back pain anymore. So then I just was like, okay, God, I feel like that's what you're telling me, like, I'm supposed to do. And then I just did it.
Wow. That is an amazing story.
Yeah. I feel like none of us kind of just stumble into chiropractic. I feel like something always leads you there, whether you believe in God or not.
Yeah.
I don't feel like, because anytime I speak to somebody, you can tell the people who are passionate about chiropractic and people who just went into it for the sake of having a job.
Right.
And the people who are passionate about it are usually people that were impacted by it for some reason or another. So I feel like those are the people who are led into the profession.
My next question is, what chiropractic school did you attend and why?
Oh. I attended Logan University in St. Louis, Missouri. Honestly, so when I went to the chiropractic for the first time, I had never really heard about chiropractic. So the chiropractor that I actually ended up going to, he was an alumni, and he was like, I told him, I was like, I think this is what I want to do. And he was like, oh, go to Logan, that's where I went. And I visited the school, and it didn't dawn on me to like visit other schools.
Yeah.
And so I visited it, and then I just went. It wasn't until like maybe the first year into like the DC program itself.
Yeah.
I think I traveled to can't remember, it's not a seminar, but it's like the big convention that we have for Baptist students. And that's when I met people from like other schools, and I was like, oh, I didn't even know there were other chiropractic colleges.
Right.
Yeah. But I think it's a good thing I went there, because I think if I went to life, I probably wouldn't have graduated when I did.
Like, going to that, I know, how was your experience as a minority going through chiropractic and your chiropractic education? If you can like elaborate on that.
It was semi-rough.
Okay.
And why? Let me explain why. So in the Bahamas, we don't really see color like that.
Mm-hmm.
Or maybe if we do, I never was exposed to it like that. When I grew up, like, all of my really close friends were Caucasian, if you will.
Right.
So I never dealt with racism. And it wasn't until I went there, and to be honest, I met Black American students, and they were kind of like trying to make me into this bubble of just Black student.
Yeah.
And I didn't understand it, because I'm like, why? We're here for all one purpose. Like, I didn't understand it. And I felt like they were trying to make racism a bigger deal than it was. Again, I wasn't from America, so I never dealt with racism like maybe you guys have.
Right.
So I really was not understanding. And then it wasn't until Michael Brown died. So you remember Michael Brown died like August 2000, I want to say 15. And I was like 20 minutes from where our school was. And that was when I saw people's true colors. Mm-hmm. And that's when I started understanding, like, racism is not dead. And I got away with a lot of things, if you will, because they thought I was mixed, and they thought that, oh, well, the Bahamas is not Black America, so it didn't count.
Right.
And then they thought, well, you're not Black, you're brown skin, or like you're an islander. And it was just these weird things. And they would have conversations around me, and I just literally sat there dumbfounded, like, are you serious right now? Mm-hmm. So it honestly was an eye-opener. I'm glad that, honest to God, I'm glad that I went through it, because like I said, I basically grew up in an island bubble, so I never experienced it. So at least I'm now able to, I guess, help people who have to go through it, like tell them how to go through it, or at least share my experience with it. So yeah, it was rough, but I guess it kind of helped shape me, if you will.
Yeah.
Because it didn't make me look at people any differently, but it just was an eye-opener. It was a black and white thing, more as you had some people who just wanted to be ahead and in the educational curve, if you will. Like, they were vying to be valedictorian, and I was just like, yo, we're all just trying to graduate. We're all just trying to help people. We are in this class together for 4 years, and we really should be trying to help each other just get to that graduating point. And I just don't think that was people's mindsets. Because I know some of them, you know, held out notes and held out help and
exactly
from their own, to be honest. So I'm not, I can't entirely say it was a racial divide, but there definitely was, you know, a racial divide, if you will.
Okay. My next question is, how long have you been practicing?
Officially or unofficially?
We'll say officially.
Officially, I think February will make 2 years.
Oh wow, congrats.
Thanks. Sorry, I don't mean to say it so dry.
No.
Like, it's been rough. And unofficially, obviously, since I graduated, which was in 2016. So I guess 3 years, 4? No, about 3 years, if you will.
On the list, but going back to how long you were practicing, what is some advice you would give a recent graduate?
Ooh, that's tough, because my situation ended up being so different from those of my classmates and colleagues. I know a lot of them had opportunities to go into associateships and open practices of their own and become independent contractors. On my island, we have, well, not even my island, the entire Bahamas, we have about 10 chiropractors, myself included. So it was a little difficult. I came home with the mindset, I'm gonna go work with somebody for, you know, a few years, get myself grounded, you know, build up a practice, not really practice, a patient base, and then venture out. You've heard the saying, I don't know if they say it in your school, but they told us a lot of chiropractors eat their young.
That they're young?
Chiropractors eat their young.
No, I've never heard of that.
So that was something that they basically pounded into our heads, meaning the chiropractors that are already graduated, they're not necessarily trying to help anybody. What they'll do is they'll bring you on, they'll use you for your knowledge, for your skill, they won't pay you what you're worth, and then just kind of leave you hanging out to dry. I was like, no, that will never happen to me. Like, of course, like, the Bahamas is so different, blah, 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 blah. Yeah. I came home, I put my resume out to every single chiropractic office, and nobody wanted to hire me. So, I then had to figure out what I was gonna do. Luckily, I had an opportunity to travel with the Olympic Committee from the Bahamas to Colombia, so I was able to like meet a lot of the athletes and treat them. And in doing that, upon returning home, a lot of them, you know, still wanted care. And so that's kind of how I started with my mobile business. So my advice would be, have a plan A, and most definitely have a plan B, because things don't always seem to work out the way that you want it to. Don't be discouraged though, because you can absolutely still figure out a path. It may not be your plan A, but still gonna get where you need to get. It just may take a little bit longer and a little bit more work.
Right.
But don't be afraid. Like, if doors close in your face, don't be afraid to just try another activity. Just climb through the window if you have to, but just, you know, do it. Don't sit around, don't slunk. People I've graduated with people who went to my schools. They're like not practicing doctors. They're like teaching yoga and they're chiropractic assistants, like so many things like that they're not doing. So yeah, my advice is stick with it. It's rough, but you'll get it. Just don't give up if it's your passion.
Okay. Why did you decide to go back to the Bahamas and practice?
There just wasn't enough of us here.
Okay.
It really wasn't. Even when I went off, which was in 2011, I still hadn't really learned about chiropractic. I still hadn't heard about it. It's not a household name. We still have this misconception that we are not real doctors, that we're really not respected in the health professional community here. And I just was like, I gotta do something about it. Now, don't get me wrong. I didn't come home or go off with the idea that I was gonna be a martyr for the cause. Hell no. I don't like being in the forefront of anything. But I was like, if we can help people without the use of drugs and medicine and surgery, why isn't this avenue explored more often? Like, why is it such a taboo? So I guess that's what really led me to come back home. I was like, America's good. You guys have got chiropractors basically on every corner. Let me go somewhere where I think that the profession is really needed and people will definitely benefit from it.
What techniques do you use? Everything.
You use, honestly, and they always said this in school, you're going to use what is best for your patient. I'll tell you, I think in my last year, I looked into Gonstead and I was like, oh yeah, I'm going to be a Gonstead practitioner. Like, Gonstead is it. You can't tell me nothing else. Girl, listen. I use Diversified, I use Thompson, I use Activator, I use Gonstead. I just use whatever works. Case in point, I have some patients who are super tense when it comes to getting their cervical spine adjusted. And as much as you tell them, relax, they don't. So you have to figure out another way, and that's where like Activator comes in, that's where Gonstead comes in. You know, sometimes you just gotta use soft tissue techniques. I just use whatever works.
And what would you say like your range of patients are in age? Like, do you more so see a mixture of everybody, or do you more so see more kids, more teenagers, adults?
Right now, it is a mixture of young and mature persons. So I would say everybody from like 20 to about 70. And that's another thing. I know you're not asking, but my unsolicited advice is don't limit yourself to a patient base. You can do it, but for me, I realized it wasn't going to be the most beneficial because, again, I have a lot of people in this country, my community really doesn't know what chiropractic is. I swear, I thought that I was going to be a pediatric chiropractor or dealing with pregnant moms. If you limit yourself, you're going to limit your potential. You're going to limit, the ability of chiropractic. And so now it's open to everybody. I see babies here and there. I've seen a few pregnant moms. I've seen geriatric. I've seen toddlers. But it's still a work in progress of getting people to, know and accept what it is that we do. So yeah, just be open to whoever comes, I guess, in your office or wherever.
Okay. So going back to when you said, like you're a mobile chiropractor, what is like your ultimate goal? Like, do you want to eventually have your own, stationary practice, or would you rather just keep the mobile thing going for now?
To be honest, my goal is to somehow win the lottery. Honestly, no.
We're gonna claim it.
Open a practice and never charge patients, so that everybody just comes in and gets care. Because honest to God, like that's all I want to do. I just want to treat people. Yeah. Unfortunately, it hasn't happened. I don't know if it's gonna happen. It's also really expensive to live here. Okay. So honestly, opening an office is not on a short-term list. I don't even know if it's on my long-term list. The Bahamas is a country that's made up of 700 islands and keys. So I feel like if I limit myself to an office, I'm not going to be able to provide care to people on the other islands.
Right.
Which means that I can't close my office for a day and fly to another there because, you know, I would have people to stay here. I would have patients that need to be seen here. So I'm not really sure if that's the route I want to go. I actually think I like being mobile so that the drop of a dime, if I have a patient on another island or a group of patients on another island that are like, hey, can you come over for a day? I can do that without any worries, if you will. So I think I'm going to stay mobile for as long as I can. Let's revisit that in like 5 years and see where I'm at.
What are the pros of working on an island versus working? I mean, I know you haven't worked in the States, but what would you say are some like major pros for working on an island or another country at that?
I think, well, I'll just say since I was born and raised here, I think the pro is that you're a familiar face. So yes, I do some marketing and I do some advertising and I try to educate as much as possible via social media, but I realize that the largest amount of my patient base comes from referrals.
Right.
And I absolutely love referrals simply because you're getting hands-on experience. You're getting it from the horse's mouth. This is how it worked. This worked. This didn't work. I tried it, etc. You know, people see videos they see videos on YouTube and they come in either petrified or they come and they want the wire strap. And I'm like, I don't do that.
Right.
You know, and you have people that have this misconception of what it is that we do. So when you get that referral base, if you educate your patient well enough, they're able to relay that same information to somebody else. Another thing is, even though the island is so small, there's still, again, 700 or 699 other islands and keys that have no chiropractors on them, but they have a lot of people on these islands.
Right.
So it's up to me or up to anybody to choose to go out and build, venture out. So I think the closeness of it is probably one of the pros because you don't have a chiropractor on every corner. The referral base is absolutely amazing. And then you're kind of starting from ground zero. So you can basically build up what you want chiropractic to be from scratch. So people don't come into it with, these bad ideas or whatever. And you can train your patients. That sounds bad, but you get what I mean? Like,
yeah.
You can train them into what chiropractic is rather than them coming from another chiropractor and just completely being like jaded, if you will.
Does your mobile business have like a name, or do you just?
Yes.
Okay, and what's the name, and how did you come up with that name?
The name is long, but it is Bahamas Concierge Chiropractic and Wellness.
Okay.
I came up with that name because initially I wanted to use Healing Hands Chiropractic. But then I had people talk to me and they were like, well, it sounds really religious and you're going to have people that are not going to be interested in that. I had to have a different perspective on it. I was like, okay. And then I was like, well, what is it that you really want to do? And to be honest, I didn't want to be limited to an office space. I really wanted to not even work in the capital, which is Nassau, but I really wanted to help people on the island. So I was like, how do I do that? And Concierge came to mind. Obviously chiropractic because that's what it is. And then I was like, okay, it can't just be Concierge Chiropractic. And I was like, well, I don't want to limit myself to just say Atlanta so-and-so or, California so well.
Exactly.
You know what I mean?
Yeah, I get what you're saying.
So I was like, how do I get to the masses? And so Bahamas Concierge Chiropractic came about. And then I actually was running with that name for a bit. And I eventually added the and wellness because, a lot more to it.
Right.
And I realized when I was explaining to people that chiropractic is really about, the whole body and the holistic aspect, I was like, I think I need to put and wellness in there so people understand it's not about neck pain and back pain. It's about nutrition. It's about, just living your best. optimal wellness, all of that stuff. And I incorporated the business, and now I'm kind of stuck with it. It is difficult. Make sure that you're passionate about it, because if you're not going to enjoy it. And just remember, the race is not for the swift, but honestly for those who can endure it. So if you're not getting through it in a timely fashion, or if you're stressed out, self-care is the most important thing. Take care of yourself, come back to it, you'll get through it. Okay. And for those graduating, congratulations. It's rough, it's tough, but again, if this is what you really want, you'll get it.
Force, yeah. So we are coming with a force, yeah. Blessings we are reap and we coursing on full. Oh, in our